Hi, John with North County Miracle Ear. Today we're going to talk about how do you know you're getting a proper hearing test. Usually what I do with most of my patients when they first come in, I explain in detail about what I'm going to be doing. So if you'd like to go ahead and look a little bit on this chart here, I'm going to go ahead and explain how we do our hearing test. The first thing we always do our hearing test in a booth, in a sound-controlled environment. And first test we do is called an air conduction test, is where we put headphones on you and we send the beeps. And we're trying to find out where you can barely hear. So we're going to ask you to push a button every time you hear a beep, no matter how faint it is. If we find that you actually do have a loss, and a loss basically is represented in an audiogram. This is an audiogram. Everything above this line here, 25 decibels, is considered to be normal hearing. Anything below this is areas of help. So these are all your low frequencies, these are all your high frequencies. Usually when you can't understand speech in a clear manner where it sounds like people are mumbling or it's muffled, it usually deals with this high frequency area. The volume of speech is over here in this side of the graph. So what we do is we're trying to find out where you can barely hear and mark it on this audiogram. If we find that you do have a loss, the next thing we're going to end up doing is what we call a bone test. We're going to bypass your eardrum, all the three little bones, your middle ear, and we're going to put a little bone oscillator on your mastoid on the back here, and we're going to send those same beeps there. We want to make sure there's not a difference between this air score and the bone score, because if there is, the loss is happening here in your middle ear, and that's something that you need to go see an ENT to see if it's something that's correctable. So if we determine that the air score and your bone score are the same, the next thing we're going to do is we're going to do some speech testing to find out if you have any auditory deprivation. We may have talked about that in the past. If not, look at one of our videos and look up what we talk about auditory deprivation. And in a nutshell, it's where when you stop losing the signals of frequencies, your brain ends up not being able to interpret those sounds. So when you put on hearing aids, your brain's not sure what to do with it. So we'll test for that, and then the last test that we end up doing is where most people have a big difficulty it's called speech and noise. Whenever you're in a noisy environment, trying to understand somebody at a restaurant or any of a coffee shop or any of those type of things, we're going to test for that, making sure how much difficulty you're having and being able to explain to you and recommend the proper hearing aid that will deal with that type of a problem. So if you are struggling with any of those issues in noise or just understanding speech because it seems like it's not clear, we want you to come in and get tested. It's free, it's thorough, and we have 3 locations. We have Oceanside, Escondido, and Encinitas, and we'd love to see you. Come on in.